Another question that we've had is, what are the things that you should ask yourself before setting out to go to the doctor versus primary care versus urgent care versus the ED? Are there a list of things you could ask yourself to make sure we are going to the right level of care?
Well, a couple of things. One is, if you're going to go to a doctor that's unfamiliar with your care, it's always good to bring a list of your medicines, either a written down list or even your bag of your medicines, all you take. It's also important, if you're going to a doctor that you're unfamiliar with, to write down your diagnoses. Sometimes you forget all the medical illnesses you have. And if there's any question as far as which level of care you go to, if you have a regular family doctor, just pick up the phone and call the office and see if there's an appointment available. And if there is, good. If there's not, you can also ask about your symptoms and if you should go to the urgent care or go to the emergency room based on that. So a phone call can be helpful in that case.
Okay.
I would agree with that also. Check with your family doctor first if there's any question.
And we see a great number of patients that have called their family physician, and their family physician over the phone's recommended that they come on to the emergency department, and it helps get you in the right level of care.
And let me say also, sometimes it's a judgment call. In family practice, we really don't want you to have a heart attack in our office. We're not prepared for it, we're not equipped for it, but yet we can see some chest pains. But at the end of the day, as a doctor's office, we try to take the cautious route. If there's any doubt, we're probably going to send you to the emergency room with certain conditions: chest pain, shortness of breath, bleeding a significant amount, mental status changes. There's some of those things we can see in the office, but if there's a question on how serious it is, those diagnoses we're going to push to the emergency room.